Okay, here's something that'll make you smile. Joining us from the Ohio Dental Association, we have Dr. Hal Jeter. Thanks so much for stopping by.
Thanks for having me again. Great to be here.
It's all about the Ohio kickoff for Give Kids a Smile. It was held just recently at Shawnee State University. As a matter of fact, Shannon did a story. We reported on it about some kids very excited and very expressive about getting those white, shiny smiles.
Absolutely right.
It makes it different. It must feel really good to have a job like that where you can make a noticeable difference in someone's life.
Oh, absolutely right. When you have someone who needs something, and you have the ability to give that, there's no greater blessing.
Yeah, I'm sure.
Definitely.
That's fantastic.
So who were the participants in the event we saw here at Shawnee?
Well, Shawnee State University has an outstanding dental hygiene training program.
Oh, okay.
And so for several years, the Southern Ohio Dental Society has been able to partner with them and use the hygiene students to be able to do the cleanings and
so that's great training then.
Exactly. Well, yeah, it's a great practical opportunity for them.
Sure.
And so you had the students from Shawnee, you had volunteer dentists from the Southern Ohio Dental Society who were doing the examinations and actually checking for cavities and things like that. Now the kids who participated were from 3 local schools in Scioto County. There was Portsmouth City School, Clay Local, and the Portsmouth STEM Academy. And so we saw about 90 children.
Yeah. That is amazing, 90 children.
Yeah, so what you see here is, the hygiene students are doing, that's the polishing part, that's the brushing part. And then, they led them in, they were very friendly. It was just a wonderful, there was no fear. And so
part of that is part of the thing, is trying to get, because some kids, they have that feeling that like, uh-oh, what's going to happen here? What's going to happen to me?
Right, but no, we're riding the chair, we're going to count teeth, we're going to get prizes, things like that.
And hopefully setting them up for life.
And hopefully setting them up for life. And the other thing, too, is, the dentists who were giving the examinations, if there were cavities and things like that detected, there's a mechanism in place to try to refer them to dentists to have that treatment taken care of.
Oh, good. Okay.
Yeah. So, but yeah, it was just a fun time.
Talk about how Shawnee got chosen as the state kickoff.
Yeah, I didn't maybe realize the reputation they had.
Shawnee State University has a wonderful reputation for all of their programs, but especially dental hygiene. And so having had the opportunity to work with this program for several years in hosting this event, and they've been very gracious to open their doors to let this event take place for probably 10 or more, almost 20 years now. But this was the first year they had the kickoff. So we chose them for that because of the quality of their program, the fact that it's gone so well for so many years. And then also we wanted to showcase Southern Ohio and the fact that unfortunately Southern Ohio counties, and many of those being Appalachian counties, still have a distinct access to care issue for everyone, especially children.
And that's real. That's not just some made-up national statistic or anything like that.
Not at all.
This is a very real problem. You guys have to see, you probably see that all the time.
I do, absolutely right. And so what you have is a situation where, for a variety of reasons, and let's talk about children for a minute, the barriers that come up, number one, may be financial. They may have no insurance or have an insurance that there's a provider that doesn't take that insurance within any proximity. There is a workforce shortage that I'm sure you're aware of in other areas of the economy that certainly plagues dentistry. And most common in that is the dental hygienists. Very short on dental hygienists. So and that's another.
There's a need for them.
So there's a need for them.
Get to school.
Exactly right. And that is a topic for an entirely separate segment to itself that we may be talking about in the future. And then other things, there are behavioral and medical compromises that a dentist, a general dentist, may not feel comfortable in treating, so they may have to travel a far distance to a specialist, and there are barriers associated with transportation and things like that. Well,
this is, what you've done is you've opened our eyes to a couple things. One, there's help out there for families who may feel like they don't have access. And number two, there is a great need for dental hygienists.
And so, when you speak about access to care, Give Kids a Smile is a great first step, but it's not the solution to the problem. Now, when Give Kids a Smile was first originated 23 years ago, the idea in mind was to have an event, and this is a nationwide thing, not just Ohio, but all 50 states had multiple events, and the kickoff is always in February, but these events go throughout the year. February is National Children's Dental Health Month, and that's why it's appropriate to kick off in February. But they go out throughout the year, but that's not the solution to the problem. So in Ohio, what I can talk about is how the Ohio Dental Association is trying to do some things to maybe get more providers where they're needed in these health provider shortage areas. And so there's a program that many years ago the Ohio Dental Association spearheaded some legislation that was enacted to establish the Ohio Dental Loan Repayment Program.
Oh, okay.
So you take a new graduate from dental school and they have monstrous dental school debt.
Yes.
Okay, so there's an opportunity for them to go into an underserved area and spend a few years there, and in return they get forgiveness of their student loans.
Great.
And then in addition to that, we have a very robust public service campaign on network radio, inviting people to consider careers in assisting dental hygiene, things like that.
That's terrific.
Oh,
well, we can't tell you how much we appreciate you coming in here to talk about this.
Well, it's a great opportunity. Thank you for having me.
It was a good follow-up to our story.
Yes, keep up the good work. The whole crew, all of them.
Thank you.
Wonderful.
Appreciate it.